not everyone can be famous, but everyone can be great. And greatness comes by service. So serving other people, creating value, being the solution, I think that's the most important thing in life. No man is an island. We need to recognize that we're all here to serve and help each other and work together. And we're actually stronger together. So if we can just break those barriers and build bridges and just, make things work for everyone. It's easy to say, but the world would be a better place.
Amos Madra.
Dr. Imohi, founder of Black Women in Health. How are you? Thank you very much for joining us, and it's good to have you here.
Thank you. I'm fine, and it's lovely to have you as well. Be here. Not have you. It's lovely to be here. Yeah.
Excellent. So, your charity, Black Women in Health. It's the name says it all. It's Black Women in Health, but it's not just doctors. You've got health practitioners in every area. Tell us about the organization itself, how it started.
Thank you. So it started as an idea when I was a GP trainee. So as a GP trainee, I had some difficulties, and most of the difficulties I saw was things to do with bias, conscious and unconscious bias. Some of the things I felt were to do with cultural differences, and sometimes just blatant racism. So I just felt, I can't deal with this type of problem alone. I used to share my problems then with my friends, with three other friends, and we formed a WhatsApp group. So we used to chat and just, bounce off each other and share our problems. They were GP trainees as well. And it was good to have that small community of, friends or ladies I could speak to and share my, woes with. And after I finished training, I thought about maybe why not make this bigger, because I started to hear stories about other trainees that were having difficulties as well. And I just felt, why not make it something bigger and, include more people, make the circle wider and provide support for other people as well. And that was how I told those two friends. By that time, one of us had moved to Canada. So I told the remaining two, I'm thinking of starting a group, like what we have, but just to open it up to more women so that we can support each other through our journey, in the healthcare. As you know, Black and ethnic minority doctors have the highest rate of complaints with the medical council and are more likely to get complaints generally. So sometimes just having someone to speak to, someone to support you, I think is something that was really important for me. And one of the things I didn't really see when I was a trainee was that, I don't know if it was based on where I was located in the UK, because I trained in Merseyside. So I didn't really see people that looked like me in top roles and, leadership positions. So I just wanted to, break that and change that narrative. So that was how we started. We wanted a group where we could empower each other, where we could connect, where we could share, where we could teach each other, and most importantly, celebrate each other as well. And, in the process of planning, I remember one day I was in practice and a teenage girl came with her mom to see me. And it was actually a practice in Manchester where I was working that day. And the girl said, can I ask, how can I be a doctor? And it really touched me because I felt, our young girls, our young boys need to see people like us succeeding, people like us in these roles. And that would make them understand that they too can. They can be anything they want to be. They can't be stereotyped to only certain types of jobs or certain types of roles in the community. Seeing people like us in this role, and I realized I am actually an ambassador and I need to be a good role model. I need to be, a representation of what we could become. And that was one of the visions. Okay, so our vision as Black Women in Health is actually to create a vision, to create a space where women can achieve maximum excellence in their career and in their personal lives. because we're a representation of our community, and we want the young ones or whoever is coming, aspiring medics, aspiring nurses, pharmacists, to see us and be like, wow, I can do that. If she can do that, I can do that. So yeah, that was how it started in a nutshell. I
Wow.
pitched my idea during my friend's birthday party in Tenerife, and then we came back. We opened up the WhatsApp group, and from 3 of us, we've grown. On our Facebook, we are over 500, and we have Telegram groups as well. And so it's grown from just 3 people to a network of over 500 women.
Incredible. Absolutely incredible. And from one idea, it's blossomed into this, incredible organization that's making a huge impact. And just your role as well as a doctor is impacting the young people who come into your presence and see you. And, if you can't see it, you can't be it.
Exactly.
So at least now with you there, it just, you've trailblazed the way and showed that, this can happen. And what an incredible story that is. Tell us about your own upbringing. How did you choose to go into the medical field, and at what age did you decide to become a doctor?
Okay, so I grew up in Nigeria. And to be honest, I was really unserious when I was in high school. I was not one of those very booky types, but I was trying. I was trying my best. And towards the end of my high school year, I decided I wanted to do something in science, but I was not too sure what it was going to be. So I was in science class. I was doing physics, chemistry, and everything. And then I read a book by Ben Carson, Gifted Hands. And that book changed my life, because Ben Carson was, he grew up in America during the time when there was a lot of prejudice towards the blacks. And he rose from like being the dullest kid in class to becoming really, successful in high school, and then went on to university, and he became the youngest pediatric neurosurgeon in his time there. So for me, that was like, wow. That's why I say representation really is important, because when I read that book, I was just like, wow, I can do this. I can do this. If he could do this, I could do this. And from that moment, I said, oh, I would like to be a doctor. I can actually be a doctor. And that was how I made up my mind. And I went to medical school. I started medical school in Nigeria, but I ended up in the Caribbean and finished up there. And that was how I, finished up, came to the UK, took my PLAB exams, and I got a job as a F1 doctor, which is kind of like housemanship in the UK. And that was how I started my journey. It was during my journey I decided I wanted to be a GP. So in the UK, you have to do 2 years, F1 and F2 as a junior doctor. And then after that, you go into your specialty training. You can decide to take a year off for gap year or do other things, but you can also go straight into training. So after my first 2 years, I went straight into training. I wanted to become a gynecologist, but I thought I could still practice what I loved about gynae in GP. And that was why I went straight to GP. And that was how I became a GP. So
Incredible. And we were talking off camera before about, being a GP, you don't know what's going to walk in. You've had to deal with so many different things. And I suppose that always keeps you on your toes.
It does. It does. As a GP and as a human being, really, learning is lifelong. You have to keep learning. And in medicine, we have to have appraisals every year and then revalidation every 5 years. So obviously, you have to keep up your knowledge if you want to be the best doctor you can be for your patient. If you don't want to do harm and you want to, make sure that you are protecting the patients and doing the best for them, you have to keep up to date. And we have events, courses, seminars, conferences that our Royal College organizes, some of them. And you can also attend from, other colleges as well, just to keep up to date. As a GP, anything can come in through the door. So it could be coughs and colds. It could be, skin problems. To your next patient could be a mental health problem. The next one could be, something suspicious of cancer, and you need to find out what the problem is. The next patient could be, something that doesn't even relate to medicine. It might be someone struggling with their mobility, and they need you to write to the council to help them, with wheelchair or something. So it's so, GP is really interesting. It's very broad. So as a GP, you need to know little about everything. You need to know everything. And then basically we are kind of like the gatekeepers to the NHS. So when patients come in and we don't know what the problem is, we have to find out what the problem is, investigate what the problem is, come up with a possible diagnosis. In some cases, come up with diagnosis in most cases and deal with it. But in some cases, we have to come up with possible diagnosis, refer to the specialist that we think they need to see. And then they go off to see that specialist. And after seeing the specialist, they are sent back to us to continue the care in the community. So it's very varied and interesting.
Absolutely. And with how things are at the moment, hospital waiting times, the government's trying to change the way patients come into contact with the NHS. So sometimes, you might find that GPs feel overwhelmed, that they've got more to do. Do you feel your workload has increased since the pandemic, or has it just always been that way?
I would say it's increased. It's always been a stressful job. It's always been a bit difficult before the pandemic, but I think the pandemic has kind of put a microscope to everything and heightened the problems that were hidden before. So I would say this because before the pandemic, there were still waiting times. There were problems getting there. People used to have to call every morning to get their GP as well. But since the pandemic, we find that we have an older population, as you know. People are living longer, which means that we're having more complex medical problems. We're having to deal with chronic medical problems for longer as well. So, with the problem in the NHS, there is recruitment issue. So we don't have enough GPs. They're trying to train as many, because even as many as they're training, some are leaving, some are retiring, some are immigrating to other countries. So, it's difficult. I think majorly the problem is recruitment and retention, funding. A lot of, funding is needed to roll some, to kind of run some services. So some services have had funding reduced or cut off totally. And those type of services, it means that patients have to be diverted to a different place and maybe have to wait longer to be seen by someone. So, yeah.
And your organization, have you had any support from the General Medical Council? Has anybody from the NHS come in to support this concept, this idea?
Yeah. When we first started, we had our second conference in Birmingham, and we engaged with the BMA, that's the British Medical Association, the GMC, and the Royal College of GPs. And we had speakers from the GMC coming to speak to us, telling us how they're supporting doctors, how they're helping international medical doctors to kind of settle and integrate into the system. And the BMA as well, we've worked with them, and we've attended a few meetings with the BMA as well, especially during the pandemic, talking about health inequalities and also differential attainments for colleagues. So yeah, there's been engagements with them.
That's good to hear.
And we have a speaker coming to our conference, our upcoming conference from the GMC as well. So.
And that's on the 15th of October. We'll be talking more about that very soon. Okay. I was looking at your website, and I was looking at some of the quotes that you had on there. Very positive, very inspiring. I know as a doctor you have to be positive. But would you say that's just used naturally as a person? And, talk to us about some of the quotes on there. They are very inspiring. Martin Luther King, one, for example.
Okay, so personally, I love quotes. I right from when I was young, I really loved quotes. I used to read a lot of books when I was younger, and I used to pick out the quotes from the books. There was no internet as we have it now during those days, so I used to read a lot. My first book ever was "Tough Times Never Last, but Tough People Do," and I wrote the quotes from that book, and I used to paste it around my bed. So it was a no-brainer that, when we started this group, we had to put like very inspiring quotes. And I love Martin Luther King Jr., and his quotes are very, very powerful. So yeah, these quotes are really just to remind people of certain things. because sometimes you see a quote and it just speaks to you, and you know that, wow, that's a powerful one. So yeah, the quotes were on the website. I think we have them on almost every page. We have quotes on almost every page just to inspire people and just tell them, you can be anything you want to be, or, the beauty of the world lies in the diversity of its people. We cannot be separated in interest or divided in purpose. We stand together. I have some favorite quotes, though. Those are not my top ones. I have a favorite quote from Martin Luther King, which I always share to anyone that's close to me, really. Not everyone can be famous, but everyone can be great. And greatness comes by service. So serving other people, creating value, being the solution. I think that's the most important thing in life.
Absolutely. Absolutely. And what a wonderful quote that is indeed. And that is the essence of life, isn't it? It's how we serve one another. No man is an island. We're here to serve each other. And I think the sooner we all realize that, the better the world will be for all of us.
Yeah.
So, yeah, brilliant quote. Talk to us about the event. We know it's going to be a busy time for you, October, around the corner.
Yeah.
So, yeah.
So as we all know, October is Black History Month. So Black History Month is about, to me, it's about remembering the history. But more importantly, let's celebrate, the past, the present, and the future. So I'm someone that likes to celebrate and see the positives of everything. So we decided to have our conferences. Our first conference was in March. Our first conference was in June 2019. Second one was in March 2020, just before the pandemic. We were so fortunate to have a physical conference in Birmingham, and it was amazing. And then we had the pandemic. We had to have our conference online last year, but it was still a massive turnout. Over 340 people came. So it was really lovely. So we decided this year to come back, face to face and have this conference. And our theme for this year is breaking the glass ceilings. So whether we like it or not, there are glass ceilings everywhere. If we look at the demographics of the NHS, I can't give the exact percentage right now, but we have a huge percentage of Black and ethnic minority doctors working, nurses, pharmacists, all specialties. But if you look at the demographics, most of those are on the lower tier, so mostly junior staff. So when it comes to leadership roles and executive roles, it narrows. The number just reduces significantly. And that's what we are trying to change, that narrative. Because to be honest, the NHS is caring for a diverse population. So the decisions made on behalf of this population should be, the people making the decisions should represent the population as well. That's how I see it. And if we don't put ourselves up there, if we don't try to break those glass ceilings to get there and be on those tables that matter, to help to be the voice for our communities, then how are we going to achieve that? We talk a lot about health inequalities, and I'm really excited that, the NHS Director for Health Inequalities is a Black woman. She's actually a Black woman in health. She's part of us, actually. So I'm excited we have someone like that, fighting health inequalities. But, it's about putting ourselves in those tables that matters, recognizing allies that are not from the Black and ethnic minority groups, and, building bridges with them to be able to help each other. Because to me, I think at the end of the day, there's just one race, human race. We need to recognize, like you said, no man is an island. We need to recognize that we are all here to serve and help each other and work together. And we're actually stronger together. So if we can just break those barriers and build bridges and just, make things work for everyone. It's easy to say, but the world would be a better place.
Absolutely. And, for people like yourself who certainly make that change in your job and in the programs and, the events that you hold, you're certainly making that change. So again, just remind us about the dates and also how the audience can connect and find out more about the event itself.
Okay, so the event is happening in Manchester on the 15th of October, and you can register on Eventbrite if you're interested in attending. You don't actually have to be a healthcare professional. If you're a Black woman or a Black man, whoever, or whatever color you are, and you just feel like being in a room with vibrant, positive-minded people that want to, make the future better for ourselves and everyone else coming, yeah, you need to be there. It'll be fun. It's not like any conference you've ever been to. It's going to be so much fun, so much to learn. And our conferences are not just medically based. So we talk about things that generally can help anyone. Because like I said, we are doctors, nurses, pharmacists, allied healthcare professionals. So we teach you, and share real life stories of trailblazers that have found their way and paving ways for other people as well.
Absolutely. And what we'll do is we'll make sure we put all the links underneath so the audience can connect as well and just go and find out for themselves. Wow. Dr. Omon Imohi, it's incredible. It's been an absolute pleasure talking to you, listening to your experiences, and it's come full circle in a way, from being inspired by other people and seeing that representation, which ultimately led you to go and follow that career, that passion that you wanted. And ultimately, you have inspired so many people. You've inspired me. You've inspired so many of your patients who come to see you daily. And with this event, you're inspiring so many more people not to limit themselves, but to break that ceiling and to reach, because it's beyond the sky. There's so much more that we can do. And you're certainly trailblazing the way. So we just want to honor you and celebrate you for that. And thank you very much indeed for sharing your time with us today.
Thank you. Thank you for having me.
If you want some amazing inspiration, check out the videos next to me, and I'll see you right there.